So today I have my patient Maddie Yorkie. She is 9 years old and she's in for a routine cleaning. I'm going to be going over her OHI. So my patient is going to be seated in an upright position in the patient chair. So I'm going to start off with her PCR score. So Maddie, your PCR score was 65%. Which there's lots of room for improvement. There was a lot of plaque biofilm accumulation in between your teeth, and I will be giving you some recommendations that are going to help reduce the amount of plaque accumulation in between your teeth. So let's talk about plaque. So plaque is that sticky, slimy substance that is made up of germs that can cause tooth decay, cavities. That's why it's so important to brush at least twice a day and floss daily. If too much plaque builds up on or in between your teeth, you can potentially get a gum disease. Now there's two types of gum disease. There is gingivitis and periodontitis. Here are some images of what healthy gums look like. It's nice and firm and pink. And gingivitis, where right here at the gum line, where the plaque can accumulate, it will cause your gums to look red and super inflamed. And with gingivitis, it is reversible with a good oral hygiene. And this is what, so there's periodontitis, and this is what it looks like. Now that is a more serious gum disease where it infects the bone. So now I'm going to be going over, before we move on, let's talk about cavities. Okay, so here is images of where you could potentially get cavities. You can get them on the top surfaces of your teeth, in between your teeth, and then at the bottom of your teeth. So the way cavities develop, I do have this little explanation of how cavities form. So Maddie, whenever you eat any sugary snacks or beverages, what happens is the sugars will mix with the bacteria in your saliva, and it will produce an acid which will sit on your tooth. And over time, if that doesn't get cleaned off or brushed off, it will cause little holes on your teeth, which look like this, which are the cavities. Okay, so let's talk about your treatment plan. So I diagnosed you as having gingivitis because of the presence of red gums, and you were inflamed, and the amount of plaque biofilm accumulation that you had, with your PCR score being 65%. So the brushing technique that I am recommending to you is the Phones brushing technique, and I would like you to brush 2 times a day. And the way you are going to use that brushing technique is you're going to make sure you're holding the toothbrush at a 90-degree angle, making sure that the bristles are resting over the teeth, and you're going to have your teeth together, and in large circular motions, you're just going to go around just like that. And on the inside of your teeth, you're going to use the same motions, just in smaller circular motions, just like that. On your bottom teeth, your upper teeth, and then on your front teeth, what you're going to do is you're going to hold your toothbrush at an angle, and from the gum line, you're going to sweep up to the top surface of your tooth, just like that. And then at this time, I will hand my patient a toothbrush, and I will be holding a mirror, and she will be demonstrating in 3 areas how to use the Phones technique. All right, and for your flossing, I am recommending the C-shaped floss. So what you're gonna do is you're going to have about an arm's length of floss, and you're going to loosely wrap it around your middle finger so you could place it. And what you'll do is, to get it in between your teeth, you're going to use a back and forth motion without hurting yourself. So you're just going to wiggle back and forth until you get to the bottom. And what you'll do is you're going to wrap the floss around your tooth, forming a C, and then you're going to do up and down motions. And it is very important that you move the strand along and that you use a clean piece of floss on each tooth. Otherwise, if you continue to use the same piece of floss, you're just moving that plaque biofilm around instead of removing it. And at this time, I would hand my patient a clean piece of floss, and she would demonstrate in 3 areas how to use the C-shape technique, and I would also hold the mirror for her. I am recommending a tongue scraper because you did have a coated tongue, and the way you're going to use this is you would stick your tongue out, you're going to hold the end of the tongue scraper, and you're going to put this end as far as back as you can, and in one slow motion, you're just going to pull the tongue scraper from the back of your tongue to the front. This rough edge right here is going to rub against your tongue and remove any of the plaque biofilm that's on your tongue. I am recommending fluoride toothpaste to help you against cavities, and I am going to recommend a kid's fluoride mouth rinse at night, in the evening, just because your saliva isn't as active as it is when you are awake. And I did speak to your mother about implementing a reward chart, just so you're keeping track of how often you are brushing your teeth and when you are flossing, and also using your tongue scraper. And with the medications that you are currently taking, it is very important that after you use your inhaler, that you are rinsing with warm water to prevent any fungal infections. And I do have on here to see your primary dentist because you do have a cavity in between your teeth, so you do want to make sure you take care of that before it gets any worse. All right, and we want to make sure that you are implementing all of these recommendations that I am referring to or recommending to you, just to make sure that your teeth stay healthy. Otherwise, it could lead to a more serious gum disease, and that's what we want to prevent. All right. Now, I categorized you as being high risk for cavities because of your current restorations that you have, the medications that you're currently taking. You do have a cavity, and your brushing habits. You want to make sure that you are brushing, those 2 times a day, just to prevent any further progression of any of the gingivitis and the cavities. So for your snacking, you snack on a lot of sticky, sweet foods. So you want to make sure you limit the amount of sugary, sticky, crunchy food that you are eating. Try incorporating some string cheese or some yogurt and some fruit. Those are better, healthier options that are going to help improve your overall oral health. And that is all that I have for you today, Maddie. Thank you for listening to me.